We had another great educational course for our staff today. Today's program was tooth preparation from a doctor's perspective. And we're lucky to have four dentists that work for us. Bianca is one of those dentists. She's a dentist in Brazil, and we're really great to have her on our full Arch team now. Before we talk about the meeting today, what's it like working in a lab after working in dentistry with the patients? It's quite different.
It's really different, but I think it's really good because I can bring my knowledge to the lab and help people knowing what we have to do. And especially when we're doing a preparation, for example, it's really tricky because sometimes you don't know where the margin is. So it's really nice when I can help people. And of course, working a full Arch, it's really enjoyable, and I'm really happy.
Yeah, we're lucky to have Bianca on our team, and Sam, who usually leads our educational meetings, had Bianca kind of step in on this topic. So, guys, why do we think it's important that the technician understands what the doctor has to go through?
Having Bianca was great today. We kind of bounced off each other, and she brought a lot of clinical aspects to it. And we talked with the technicians today about what the doctor goes through, because when we do things wrong, that could go through a bad day for the doctor. Okay, that'll push patients back, and things will go wrong, things will crack if they adjust. Materials are sensitive, so we wanted patients to understand the process of preparing a tooth, putting a tooth in, checking the adjustments, understanding all the processes involved in getting it right. Because you have a certain amount of time in a day.
Yeah.
From experience, once you start to get in trouble with a crown or something, what happens? You're adjusting.
It's going to affect your day, for sure.
It's going to affect your day.
And also, I was really interested to explain how we're going to end up doing a crown, because sometimes people don't know. We just get impressions and we don't know what's going on. So we have aesthetics problems, and then also caries can cause that. So it was nice to talk about that.
And we talked a lot about endodontic treatment today, and we explained what caries were, why we do MOD onlays, MO onlays, and things like that. It was really productive for the technicians to understand why we do all this.
It was nice that this course was kind of geared towards newer technicians. Somebody who's only been in the business a couple of years. A lot of trainees were there. A lot of our newer people. So they've learned the dental lab technology. Now you really gave them a view of what's underneath there that we're working on.
Yeah, and I asked a question today of the technicians. I said, hey, raise your hand if you've ever had a crown put in your mouth. And 30% of the room raised their hand. A lot of people have never had a crown or even dental work,
right?
So they don't understand the process of.
Must be good fresh water in Ohio, right? Fluoridated water.
I guess that's a good thing.
If you drink tap water, it helps you to prevent caries, for sure.
Absolutely. Yeah.
I know towards the end we also talked a little bit about who we're responsible for, and what if we don't like something that we see in a case. We talked about our technical service team. I know, Sammy, ultimately at the end of the day, we're responsible. The consumer is the patient, and that's who we're caring about at the end. But at the end of the day, we're following the doctor's instructions, because we don't know the dialogue the doctor had with the patient and what they agreed to, and even they might have given them a warning. Because a lot of technical questions do come up where we wonder if things can be better sometimes.
Yeah, I hate to say it, but sometimes we as technicians, with the information that we have, we sometimes think the doctor made a mistake or is wrong. So, and it's not that we're doubting you or questioning the doctor, but we bring it up and we bring it to our technical team, and we say, hey, I think the doctor made a mistake here. This really shouldn't be like this.
And I think sometimes the doctor is not aware of what's going on as well, because sometimes they say to the system to fill it up the RX.
Right.
Yep.
And then sometimes we have misinformation. So that's why it's so important to read the RX. And then if you have questions, just call the doctor.
Right. We see things down the road that maybe they missed or anything like that.
Yeah, it was interesting. We were just at the annual Perio meeting in Miami last weekend. We conducted a hands-on course, and one of the subjects I know came out was filling out RXs, and literally nobody in the room filled out their own work, work authorizations, RXs for labs. They were outsourced that to all their staff, which is fine, but they might not actually know what's going in the box and what's getting sent.
Exactly.
And especially now that things have gone digital. because we know that the doctor scans maybe the prep and then leaves the opposing to scan for the assistant. Then the assistant has to fill out the prescription, and you know how vague that can be. So we really emphasized we go by the RX. That is our go-to. A client is the dentist, period. We go by that. And it was many times we can make recommendations. Ultimately our client is the doctor. Yeah.
Well, great job today, both of you. I think everyone took something from it, and that video is available to view for some of your newer staff members or on your team, a clinical team or technicians out there. It's available to view. So thank you very much.
Thank you. Thank you for having us.
To receive a copy of this lecture, visit www.rodentallab.com/ROE Reviews.